Organ transplantation can be the only chance of survival for many patients who suffer from end-stage kidney disease, liver cancer, and cirrhosis. The problem is the number of potential recipients far outweighs the number of donors, taking an average of 3 to 4 years and sometimes reaching up to 7 years, and many do not survive that wait. But there are the doctors who are finding ways to change all that.
They are taking on new challenges with organ transplants using marginal organs and donors of different blood types. The team of doctors at Korea University's Anam hospital are pushing the boundaries each day. These are their stories. One of the leading organ transplantations is for the liver. They are essential for patients with liver cancer, liver cirrhosis, and acute liver failure, and can be conducted in 2 ways, either by using deceased donors or by surgically removing a portion of a liver from a living donor and then transplanting it. And there are conditions that need to be met for transplantations. If the donor's liver has more than 30% fat, it makes it difficult for transplants. This is because the fat obstructs the blood flow and can cause malfunction even after the transplantation. But this team has succeeded in giving life to a liver with more than 60% fat from a patient in a vegetative state. After the transplantation, the fat in the liver has completely disappeared, and the patient is living a normal life. What made this surgery that others said would be difficult possible?
The most important factor is minimizing the time gap between the surgery for the donor and the recipient to make sure that the time when blood is not flowing through the liver is at its minimum.
These doctors are taking on new challenges with organs deemed unfit for transplantations, and their high survival rate is also at the center of attention. This patient from Russia was terminally ill with liver cirrhosis and liver cancer, and he came to Korea after hearing about the medical team.
I was diagnosed with liver cancer, but in Russia they said even with chemotherapy I would only be able to live 2 to 3 years and that a liver transplant would be difficult. But I heard from a colleague who was treated here that Korea is advanced in liver transplants. That's how I came here.
Kirishenko's son-in-law donated 67% of his liver, and these living donor liver transplants are much more difficult than receiving one from a deceased donor. This is because blood vessels must be connected to the small surgically removed liver portion. That's why all staff members must work closely together in a highly intensive environment with meticulous operations. How will the transplantation go for Kirishenko?
If the patient recovers well and receives follow-ups to monitor hepatitis C or recurring liver cancer, since he has undergone a transplantation, as long as there are no rejections, we can expect a much better survival rate.
Along with liver transplants, kidney transplantations are also one of the most needed surgeries. Kidneys remove waste products in our blood and water-soluble waste. That's why malfunctioning kidneys can cause a wide range of problems.
If the toxins can't exit the body, it can cause uremia. The simplest of the problems would be indigestion. And on the more extreme end, there are cardiovascular disease, high blood pressure, and heart failure. It could also bring about many other effects, such as hurting the immune system or causing coagulation disorders. And people may die from complications.
These patients with renal failure rely on dialysis and are fighting with various complications. The only way to save them would be to carry out a kidney transplantation. Generally, transplants are carried out when blood types are compatible, but now there are more options, even for incompatible blood types.
If the blood type is different or if the recipient has too many antibodies, the body can reject the organ. So for those patients, we have to conduct plasma exchanges.
Dr. Chung Cheol-ung is not only familiar with transplants between incompatible blood types, but also high-risk foreign patients who have high antibody counts. As a result, 66% of all foreign kidney transplant patients in Korea received surgery here, making it the top kidney transplant center for foreign patients. The kidney transplant team actually made a trip to Kazakhstan to treat a patient with type A diabetes and end-stage renal disease. There, they succeeded in a simultaneous kidney and pancreas transplant. It's the third time in the world to succeed in such an operation, a testament to the team's outstanding skills. Dr. Chung is also aggressive with cases that are considered challenging for transplantations. Among those waiting for an organ match, roughly 10% die each year. Dr. Chung believes even with a marginal donor, it still improves the survival rate for those on dialysis, and the transplant can provide people with a normal life, a belief that stems from supporting research.
The consensus that all doctors have is that what's important is giving a new life to all the organs possible from deceased donors that come in small numbers. But at our hospital, we take things to the level and also try to proactively use donors that are considered to be in high-risk groups.